All right. Well, thank you everyone and welcome to today's event. This is the COVID-19 vaccine Q&A with Dr. Rooth from Cayuga Medical Center on behalf of the Tompkins County Health Department and the Tompkins County Emergency Operations Center. My name is Shannon Alvord. If you've not met me yet, I've been working for Tompkins County for a few years now, and in the last year I've been doing a lot of help with the public information team. This event is something we're very excited to launch today to be able to provide our community members with important information about the vaccine. We know that there are a lot of questions out there, and we're really appreciative of community members who have been sharing those questions and concerns with us already to date. And we're really glad to have so many folks joining us today for this event. So please keep in mind that this Q&A is to focus on vaccine concerns. We will not really be getting into questions about the administration or the distribution of the vaccine today. Any of those questions, please do feel free to submit them in the Q&A. I will mark them down and we will address them at a future event, either a town hall with Public Health Director Frank Krupa or through a press release or something to that effect. I'd encourage everyone, if you have not already done so, to register for vaccine alerts with either Tompkins County's Swift 911 or through, if you would like to just get information about the vaccine only, you can sign up for health alerts from Tompkins County Health Department. I'll share links for those in the chat. So what I will now do is just to sort of set the tone for today, I'd really like to show a brief video that will help to sort of explain the health department's stance on the vaccine, give a little bit of information about the registration process.
Vaccines protect us all. We all need to get vaccinated to protect ourselves, our families, and our community. When it's your turn, sign up to get vaccinated. The vaccine has been studied by independent scientists and is safe and effective. The vaccine will not give you coronavirus. It is not putting anything dangerous into your body. Some COVID-19 vaccines require 2 doses, and you must get both shots for the vaccine to work. Other COVID-19 vaccines will only have 1 shot. You will be given information on which vaccine you are to receive when you register and go to get your shot. The vaccine is being given out in phases, or groups. Doctors and nurses received the vaccine first. In January 2021, it is the turn for teachers, first responders, police and fire workers, public transit workers, grocery store workers, and people who are 65 years and older. As more people become eligible, the health department will tell the community right away. When it's your turn, you will register online through a secure New York State system. Once signed up, you can get the shot at the shops at Ithaca Mall, 40 Catherwood Drive. If you are age 65 and older, register with your local pharmacy. Other locations will be available as more people can get the vaccine. The vaccine is free. There is no copay. You will be asked if you have health insurance, but it is not required. Even though people are starting to get the vaccine, everyone needs to continue wearing a mask, washing hands, and keeping distance from people you don't live with. A lot of people have to get the vaccine before we can all be protected. If you have questions, go to the Health Department website and click Vaccine Information. You can also call 211 with questions about the vaccine and options for registering. Remember, keep wearing your mask.
So we will get started with our Q&A. Again, if you're just joining us, please put your questions into the Q&A chat box. That's the best way to get your questions to me. We will also make time towards the end of the presentation today, the last 20 minutes or so, if there's anyone who has called in and would like to vocalize their question, or if you're watching over your computer and you'd also like to just voice your question, you're allowed, we will, allow you access to do so. We will get started with our Q&A questions. And I'll introduce Dr. Rooth to you. So Dr. Rooth comes to us from Cayuga Medical Center. She has been on the scenes working with COVID patients and has a lot of great information to share with us today. We're very pleased to have you. And I'd like to just ask Dr. Rooth, what is your background, and briefly, and why did you feel like it was important to join us for this discussion today?
Well, thank you, Shannon, first for having me. It's a privilege to be here. I did my residency in internal medicine and pediatrics, and I finished residency in 2012 and moved to Ithaca at that time. So I've been here for almost 9 years with my family, working at Cayuga Medical Center as a hospitalist. So if you come into the emergency room and you're deemed sick enough to stay overnight, a hospitalist such as myself would admit you and take care of you throughout your hospitalization. And we would communicate with your primary care provider regarding what transpired during your hospitalization. I also work in Ithaca convenient care and Cortland convenient care, and I used to work in kids care. So I really only take care of sick people. I don't work in primary care. The reason why I wanted to do this is that, I've been here for 9 years. I'm very embedded in this community. My husband is a professor at Ithaca College. I have 3 school-aged children, and I've taken care of this community for almost 9 years. So it's important for me to give back and to help people feel informed and comfortable about getting vaccinated and understanding, what they're doing and feeling comfortable about it. I think that being my unique perspective is that as a hospitalist, taking care of patients with COVID, kind of being behind the scenes from the beginning. And this isn't really kind of as a scare tactic or to instill fear in people, but if you talk to anybody that's been in the hospital or anyone that has a loved one in a nursing home, people can recognize how devastating it is and how frustrating it is with communication barriers. And so just for an example, kind of a picture of how things would play out if you got sick and went to the emergency room and you had any type of COVID symptoms, such as fever, cough, diarrhea, anything, you would be labeled a PUI, meaning a person's under investigation. And we would put you on isolation precautions. So we would put a special HEPA filter in your room, which is like a loud fan to kind of help purify the air. So it's loud with this fan. And then everyone that comes in your room has to wear all this protective equipment. So an N95 or a PAPR, and then another mask over and a face shield. So the communication barriers with the fan, the HEPA filter, and the face shield is challenging. It's hard to hear, it's hard to communicate. It's been horrible for older people who rely on lips to understand, who are hard of hearing. We do our best to use the phone, use the iPad, and figure out ways to improve our communication, but it's been a challenge. So once you become a PUI and it's decided you need to come into the hospital, you stay under isolation precautions. And anyone that comes in your room has to wear all of this garb. And when we have a surge of COVID patients in the hospital, we don't have private rooms for everybody. So there are times where you're sharing a room with another patient that has COVID. And you're confined to your room, unfortunately, because you are contagious. You can't walk the halls. You can't have visitors unless under specific circumstances, we do allow visitors. So it's incredibly frustrating for the patient to be kind of in their room feeling terrible and having a hard time with communicating with their loved ones, with staff. The healthcare providers and the nurses have done a wonderful job, and we're doing the best we can given the circumstances. But the barriers are real, and it's not to scare people, but it's the reality of the situation. I also, think that we don't really understand the long-term side effects of coronavirus either. I just saw somebody in urgent care who had COVID a few months ago and now has lung disease, had never had lung disease before, and now he needs to see a specialist and he's on inhalers. And so it's devastating for him to get this and now to have these side effects from it. And we don't really know, are they going to be permanent or not? We don't know that yet.
Thank you so much for sharing your personal experience there. I think it really helps to highlight how devastating this disease is and why we feel strongly about the vaccine and why we're hosting these events today. So thank you for sharing that, Dr. Rooth. All right, we'll kick it off with probably one of the biggest questions that there is. And just, I know no one is claiming to be an expert here today. So, do your best. But this first question is, what we're all wondering: why should we trust that the vaccine is safe?
I think, we rely as physicians and healthcare providers, we rely on the science and the data behind what we're given the vaccine. And so, they had 2 clinical trials with the 2 vaccines that are being distributed currently, Moderna and Pfizer. And these 2 clinical trials had more than 30,000 people in each of their trials. And they went through the same process that you go through in the vaccines that are already being distributed and have been being distributed for years. So it's not any different than it was before, for instance, for the flu vaccine or for MMR vaccine. So these clinical trials have shown through their various phases that they've had gone through and going through the FDA and other committees have shown it to be safe. And it also has shown to be 94 and 95% effective. So that, based on the science and the data, has made healthcare professionals comfortable in all the regulations that had to go through to allow it to be distributed, to feel comfortable that it is safe. I got the vaccine, right when it came out. The science behind the vaccine, and again, there's people that are a lot smarter than me that created this vaccine, and to try to understand this is, as you know, it's an mRNA vaccine, and it is encapsulated by a lipid nanoparticle and has salt and sugar in it. So it's basically a little fat soluble particle holding the mRNA vaccine. And this mRNA vaccine has manufactured the spike protein. So we've all seen this coronavirus molecule, right, with all the spikes on it. So we've created a spike in this mRNA vaccine. It's not the virus, it's not the live virus, it's a manufactured spike. And we inject it into the muscle, into your deltoid muscle, and it goes into your body and it attaches onto a cell, a ribosome. It does not attach to your DNA. It does not affect your genetic sequencing. It attaches to a ribosome and then it expresses this spike protein. And so then your body sees the spike protein as foreign. It recognizes this does not belong here. And it creates an immune response. So your body starts to fight against this spike protein. It creates memory cells. I want to remember this as foreign and I want to kill it. And so that's kind of the prime of your first vaccine that you get. And then a few weeks later, you get your second vaccine, and it's commonly known to have more side effects with the second one because your body has already recognized the spike protein. So you get the same exact vaccine the second time, and your body creates a more robust immune response. It creates more symptoms. So it's not unusual to have more side effects the second time. And as much as I didn't want to have side effects, I felt good about getting side effects because I knew that was my body kind of creating an immune response and creating antibodies to the spike protein. So then if I do get exposed to COVID, my body will immediately recognize it and destroy the virus so that I won't get significant symptoms from the disease.
Thank you for that explanation. So we have had some questions about, what are typical reactions? What's a normal response for our bodies to have when we get that second dose? And what are things that would be a concern, a reaction that might be an allergic reaction?
So everybody's going to have different side effects. I think the most common with the first shot is arm soreness. And so you can have a localized reaction where your arm is sore, some redness, some swelling. That is not unusual at all. With the second vaccine, most people are getting some headache, some body aches, fatigue. Some people are even getting fevers and some diarrhea, which are all normal response, immune response. I think the younger you are, it seems that the more robust immune response you're having. There also is a thought that if you've had coronavirus in the past and you get vaccinated, which we still encourage people to get the vaccine, even if they've already had COVID, your body is probably recognizing that spike protein from the original virus. And so you may have more side effects than someone that did not have COVID.
Okay, so it is recommended that if you have had COVID, you should get vaccinated as well.
Correct, yes.
Great, thank you for clearing that up. Okay, another question here. So are there things that folks could do that would help to make the experience better? For example, after you get your shot, should you walk around? Should you try to move that muscle in your arm, or should you kind of relax and be still? Are there any suggestions for how to make the experience a little more pleasant?
So I don't think there's a lot of data behind what can make it better. I think a lot of people I know get it in their dominant arm because then they're going to use that arm more. And the thought is if you're using your arm more, then you're going to have the pain's going to go away quicker. I do know that there are some studies with the pediatric vaccines about not taking any ibuprofen or Tylenol prior to the vaccine because you want to kind of boost your immune response. So it's not really recommended to take the Tylenol or ibuprofen or NSAIDs before you get the vaccine. And it's really just listening to your body. Like if you're tired, then don't overdo it. If you feel fine, then you can go about your daily lifestyle.
Thanks. And what about allergic reactions? What are concerns? What does a typical allergic reaction look like? Are there specific, folks who have different other conditions? Are they more susceptible if you've been allergic to a vaccine in the past?
So this vaccine is pretty unique in that it really has no preservatives in it. There's no antibiotics. There's no, there used to be thimerosal in vaccines. There's none of that. There's no aluminum, there's no formaldehyde. There's really not a lot of, there's not anything in there that is an absolute contraindication in getting if you have a severe reaction to anything. I would say if you have a history of a severe adverse reaction that I would talk to your primary care provider about getting the vaccine. But there hasn't been anyone, for instance, in the past, if you had anaphylaxis to egg, it was recommended that you didn't get the flu shot. That's not the case for this vaccine. There's no correlation with any substance that causes anaphylaxis. But if you have a history, I recommend, consulting your primary care provider. Also, at these sites, we have providers on scene at the vaccine sites, and you're supposed to stay, for 15 to 20 minutes to be monitored. So if there were something to happen immediately, you have healthcare professionals who are there to react and to treat accordingly.
And kind of to go along with that, a question has come in asking, what if you don't have any side effects? If you get the shot and you feel pretty good, maybe you're a little tender on your arm, but other than that, is the vaccine still working?
I mean, I think we have to feel confident that yes, no, you did not get a dud vaccine. I mean, it's just, your body's, everyone's going to have a different response. I think it's still working and it's still effective.
Another question similar to what you were just speaking to about the, there being other vaccines that have had additives like probiotics and things like that. Is there any problem with the vaccine for those with shellfish allergies?
Not that I'm aware of, but again, if you have anaphylaxis to a shellfish, I think it's worthwhile to talk to your primary care provider, before getting the vaccine. But not that to my knowledge, there is no contraindication if you have a shellfish allergy in getting the vaccine.
Great, thank you. So one of our listeners today has said that they're pretty nervous about getting the second shot and the side effects. Because of their age, their health, and hearing from other friends just about some adverse reactions. Do you have anything you could share that might help this person feel more confident in getting that second shot?
So when I got my second shot, I really tried to make sure I wasn't having any significant plans or working the next day so that I did have time to kind of take it easy and kind of, respond to whatever symptoms I was having if I needed to rest or whatever. I think reassuring yourself that if you do have side effects, that is your body, starting to build antibodies and to help protect you for in case you do get exposed to the virus. So that's really your body working. So, kind of feeling reassured, that you're having a robust immune response is not a bad thing. It feels bad, but it's not a bad thing.
Thank you. And if you have an autoimmune disorder or another condition and you're concerned, do you recommend, yes, that you should still get the vaccine, or is it really case by case? They should follow up with their primary care?
I think if anybody is hesitant, that you should always follow up with your primary care provider. I mean, the goal is to protect the people who are immune suppressed. I mean, you are the people that we want to protect against, and we want to provide this extra layer of protection. And there is no contraindication if you have an autoimmune disease to getting the vaccine. You are kind of the main targeted audience that we want to be vaccinated because you're at higher risk for having severe COVID symptoms and being hospitalized. So you are the population that we want to protect and give you this extra layer with the vaccine.
Great, thank you so much. Okay, our next question is, if I'm really still unsure about getting the vaccine, what's the danger in waiting for the pandemic to end? What would that mean for myself or for my community?
Well, I mean, I guess the question is, when is the pandemic going to end? I don't think any of us know. I mean, we can make speculations and educated guesses, but this could go on for another year or two. So the longer you wait to be vaccinated, the more likely you are to be exposed to the COVID disease. There's just another, I always call it another layer of protection. So you can kind of, take your chances, but we don't know how long this is going to last. So in my mind, I'm taking care of coronavirus patients, and we have this huge surge in December. Hospitalizations went up, and I was very anxious and I was very nervous. And I wanted to get as vaccinated as quickly as I possibly could. And, I got vaccinated. I've gotten both sets a month ago, and I haven't changed kind of my lifestyle at all. But I can tell you I'm way less anxious now when I go into a COVID patient's room. My stress level is less because I know I have another layer of protection for myself. And I know a lot of my healthcare colleagues feel the same way. We really haven't changed anything that we do, but we feel the stress is less, the anxiety is less.
I think that's a really great point, Dr. Rooth, because I think the mental health side effects of this pandemic have certainly weight on all of us. And I like the way that you phrased that. Excuse my family interruptions here. Hold on a second. Just a second, sweetie. So I think that, your addition of, we're wearing our masks, we're washing our hands, you're donning other layers of PPE in the hospital setting, and this vaccine is an additional layer of strategies that we can use to protect ourselves. So I like that. I like that a lot. Our next question is, well, it kind of speaks to the same thing. If we've gotten the vaccine, my colleagues have gotten the vaccine, or my neighbors have gotten the vaccine, do we need to still continue distancing? Do we need to still together wear masks and things like that? What would you speak to for that?
I would say yes. I mean, we're still in the height of this pandemic where we're still seeing, surges of outbreaks and cases. And, I think about someone kind of explained the vaccine is like wearing a bulletproof vest when you're going into like a gunfire. And this bulletproof vest is not 100%, but it certainly don't want to go into open fire without it. So, you're wearing the bulletproof vest along with everything else. I'm not going to stop wearing it because somebody else is vaccinated. The other concern is we don't know yet is if we can be an asymptomatic spreader. So if I'm vaccinated and I get exposed to COVID and I have COVID, but I have no symptoms and I'm around somebody else and I'm not wearing my mask, I may give them the virus. We're studying that right now. We're hoping that we are not asymptomatic spreaders, but we don't know. So until we have more information and on how we can live and survive all vaccinated with herd immunity, I think we have to continue wearing our layers of protection. And I'm in the hospitalist office with my colleagues. We've all been fully vaccinated and we also wear our masks. I mean, it's just how it is.
Thank you so much. Would you mind explaining what herd immunity or community immunity is a little bit more detail?
Yeah, so herd immunity is the concept of having, we think about 70 to 80% of the population vaccinated. I look at it as, say you have a newborn who cannot get vaccinated for pertussis or the whooping cough. So all the adults in that household get vaccinated for pertussis because they can be vaccinated, they're eligible, and they are providing this herd immunity to protect this newborn who can't be vaccinated. The idea is the population that is eligible and can be vaccinated, and it's a large percentage, about 70 to 80%, we can protect against those who can't be vaccinated, like the newborn, babies and other populations that aren't able to be vaccinated for whatever reason. Dr. Fauci thinks we need about 70 to 80% vaccinated in order to have herd immunity for this.
Just another question about underlying health conditions. Have you heard about any data from clinical trials about neurological issues like Parkinson's? Again, is this something that really should just be a conversation with your primary care? Have you heard anything about that?
I have not heard any side effects related to neurologic issues related to the vaccine. I do know of neurologic issues related to getting coronavirus. There has been what they're calling brain fog. People with coronavirus are getting delirium. So we certainly know the side effects with getting infected with COVID and the neurologic complications. Regarding the vaccine, I'm not aware of any.
Can you share anything with us about, locally we've had either the Mrna or the Pfizer vaccine, with talks about the Johnson & Johnson vaccine being available later in the year. What's the difference of that vaccine? One dose? Is it more effective, less effective? what information can you share that you know about the Johnson & Johnson vaccine and why it's different and what we need to know?
So I don't know much about the Johnson & Johnson. I do know that it is one dose, and I do know that it is slightly less effective with preventing coronavirus. I do know that it's also effective against the variants as well. I think it's still, being studied as well. So I don't know a lot about it. I would also say that, we do a lot of things. We take a lot of medications, and I compare it to people who have cancer and who are getting chemotherapy, right? Their chances of survival, maybe 20%, but we still take the chemotherapy, which is, killing our good cells and killing the cancer cells. We're willing to take that risk. So having a vaccine that's 74% effective is actually really good in medicine numbers, considering all the other medications we take that say this only has a certain percentage of chance of curing your disease.
Thank you. A couple more questions back to, you had just spoken about, that we're not yet sure if the vaccine will protect us from transmitting the disease. So we have a few questions related to that. One is, if the rest of my family is vaccinated, but I have not yet been, can they still transmit it? Do I need to stay away from them? Again, back to that, like, can we start gathering once we've been vaccinated?
Yeah, I think we don't really know for sure yet. The studies, these clinical trials didn't look at that to see if they are vaccinated asymptomatic spreaders. If your family is already kind of in your bubble, then you kind of have to be willing to take that risk. But I wouldn't be 100% confident as an unvaccinated person being around someone that's vaccinated, feeling comfortable that they're not going to give me COVID. We just don't have that information.
Thank you. That helps to clear that up for sure. If I were vaccinated and I became an asymptomatic carrier, if I was tested for COVID, would my test be positive?
Yes. If you had COVID, even with people who have no symptoms can test positive, and they're considered asymptomatic positive.
Thank you. You spoke a little bit about this at the beginning when you were explaining about this vaccine, what it looks like, what it's made out of, and you explained the manufactured spike. I think that's going to really stick with me as a good visual. We have a participant who's asking, is this vaccine experimental? This has been done in the past. How can we trust that this is or is not? And is it going to change my RNA?
So it's not experimental because it went through the same clinical trials and the regulations as every other vaccine that is available to the population. So it's not experimental. Is it new? Yes, because we've never had a pandemic like this in the past 100 years. And so that's for that. For in terms of, is it going to change my RNA? No. So it attaches to your ribosome. It does not get integrated or change any sequencing. And the mRNA disintegrates in 24 hours. And then the buffers, the salt and the sucrose and the lipid particles break down in 2 to 3 days. So it's not there permanently. It's a very short-lived vaccine.
Thank you for that. This question is something that has come up recently. There's been stories in the news. Folks are pretty concerned about, have people died from this vaccine? What's the information out there on that?
No, so I think the uplifting results from these studies have shown that there have been no deaths related to COVID within those who've been vaccinated, and they have reduced the severe disease of coronavirus. When you are mass vaccinating a large population, more than 40 million people, there are going to be other incidental events that happen that not necessarily associated with the vaccine. So I know that there was a physician in Florida who got the vaccine and his platelets dropped and he had a bleed and he died. There's no evidence to suggest that the vaccine is related to his death or his complications. I think that is the nature of human population. When you're vaccinating that many people, you're going to have other diseases and events that are unrelated, but just coincidental.
Thank you. Yeah, I think that's really good to remind us all that could very well be the case. So thank you for that explanation. So kind of in a similar vein, will the vaccine increase my risk of contracting COVID because maybe my body is now more familiar with the virus? How does that
So the vaccine is really priming your immune system to recognize this virus. So when you get the vaccine, there's no live virus in the vaccine. So you cannot get the virus from the vaccine. And this vaccine creates memory cells in your body, so it will recognize the spike protein. So you have a quicker immune response to fight against it and to not become significantly symptomatic. The goal is to reduce severe symptoms from coronavirus. The idea of vaccinating the mass population is to create the coronavirus as a common cold, is to reduce the significance of the severe symptoms and to reduce hospitalizations and deaths, and to allow COVID-19 just become another common cold.
Thank you. We're hearing that some medical professionals are against getting the vaccine. Is that something you're hearing locally at all? Why might the medical professionals discourage folks from getting vaccinated?
That is upsetting to hear. I don't know. I mean, I'm going off of the science and the data and speaking with my infectious disease colleagues. I'm listening to webinars from virologists and Dr. Fauci. So I don't know where their information is and why they would be hesitant to get the vaccine, especially healthcare providers who are in the thick of it. The colleagues that I am surrounded by, I know are getting vaccinated. I know it is a concern because when patients come in, they always ask me, did you get the vaccine? The loved ones are like, who's been vaccinated here? And, while I don't ask everybody that I work with, did you get vaccinated? I'm assuming the majority of people that I'm working with in the hospital have been vaccinated.
Thank you. I am seeing a lot of questions in the chat asking about, I'm trying to register, the site's always full. When will the general public be able to register? I'm part of the immunocompromised crowd and looking to register and wanting more information. I will just share that because there are a number of questions, so I would like to just remind everyone that today we're going to really just be talking about the vaccine itself. There will be more information forthcoming from the Tompkins County Health Department at some point this week regarding all of these questions, especially regarding the latest additions to the phases that have come through from the state. So please stay tuned for that. I'll throw the the signups for alerts back into the chat box in case you missed that. I would definitely encourage everyone with questions to sign up for one of those alerts so that, as this information comes out, you can be able to hear about it right away. For Dr. Rooth, our next question is, how long can a long hauler test positive? This is not so much about the vaccine, it's a COVID question. Do you know an answer to that if you have one?
I think it varies. There's no exact timeline that we know how long people test positive for. I know that you can test positive for a long time, but not still be contagious. You could still be shedding kind of a dead virus. So your infectivity is no longer an issue, but you still test positive. I don't know the exact time frame, but I know it can go on longer than you are contagious for.
If you are vaccinated, will your body react to any other diseases besides COVID, or just have a response to COVID?
So it's specifically geared for the spike protein on the coronavirus molecule. So it really wouldn't respond to any other illness that you get.
Sorry for my child joining us today. She's curious about the vaccine too. Okay, so we have a participant who's asked, I have an elderly friend and they received their first shot of Mrna and their heart rate dropped pretty low. Is that a common response to getting vaccinated?
Not that I heard. I think the whole process is kind of anxiety, stress, producing, because we're all anxious, those who want to be vaccinated or even nervous about getting it. So it's possible that she had what we call a vagal response to being vaccinated, not necessarily that what was in the vaccine, but just the circumstances of the situation created her, we call a vagal response, where her heart rate dropped. I know when I got mine, I was excited, I was nervous, I was stressed. So it was probably the circumstances and the situation, and not necessarily any of the ingredients or the product of the vaccine.
Thank you. Have you heard anything about the clinical trials for children and when they might be able to get vaccinated?
I know that they're currently studying children 12 and up. So hopefully, I've heard that maybe by the end of this year, they'll have a vaccine for that age group. I don't think they have started under 12. So unfortunately for that age group, it won't be until next year.
Thank you. Okay. We have another question here. If I already had COVID, how long will the antibodies show in my blood?
I don't think we have an exact timeline. I don't think we know it. It varies depending on each person. So some people, it's not very long, a month. Some people it's longer. I think it varies case by case. I don't think I would feel very reassured that I have immunity to the virus because I got COVID a month ago. I would be nervous that my immunity is no longer there. So I would not rely on being infected in the past as a layer of protection against it again.
Okay. Thank you. And so you had spoken earlier about, that the second dose makes the side effects a little more severe. And that's because our body is now recognizing the COVID spikes and is responding to that a little more intensely. And you had mentioned that it's discouraged to take Tylenol or ibuprofen beforehand to kind of mitigate those effects because we want the body to have a chance to respond to the vaccine. Do you know anything about a suggestion to take vitamin C in the weeks leading up to a second dose to reduce side effects? Is that effective? Is that anything that you have heard about?
I have not heard anything. I haven't seen any studies about vitamin C before the vaccine. I don't think it's going to be harmful in taking it. So, yeah.
Great. Have you heard it? This is a question I've kind of had as a parent. Have you heard if they're going to add COVID to a seasonal flu shot? Will it become something that we need to get annually, like the flu shot?
I don't know. I talk to my infectious disease colleagues, they think that it's probably going to be something like an annual vaccine, but I don't think we know yet where we're headed.
This is a question that maybe you could speak to as someone who works within the hospital setting. A participant has heard that the vaccine is being discouraged before getting certain medical procedures. Why might that be?
I have not heard that. I would want to get the vaccine as quickly as possible before any procedure, just because, depending on whatever that procedure is, you're just not as healthy as you were if you're having some major surgery. So I would want that immunity before, I have to have, abdominal surgery for instance. So I have not heard that being discouraged.
Thank you. We have a viewer today whose 90-year-old mother is not willing to be vaccinated. Do you have any suggestions for how we might encourage family members who may be vulnerable, who are hesitant about getting vaccinated?
I don't know. I mean, it makes me sad to think that a 90-year-old can't be vaccinated because it's so hard to be 90 and to be sick in the hospital. And this is not to be like to scare people, but 90-year-olds are often hard of hearing, and they can get confused easily when they're not in their own environment. So you put a 90-year-old in the hospital in a strange environment, surrounded by people whose mouths are covered. There's a loud filter fan going. We're all wearing gowns, and they can't leave that room. And so, it's sad, it's hard, it's confusing. And 90-year-olds are more likely to have severe, disease, and more likely to be hospitalized, and higher incidence of death from coronavirus. And, if you're in the hospital and visiting restrictions, take place. And so that person can't see their loved ones. And 90-year-olds have a hard time understanding technology with FaceTime. They don't understand why their loved one is on the screen and not in person. So I would want my 90-year-old loved one to be vaccinated so that eventually I can hug them and feel safe that I'm not giving them, the virus and increasing their risks. And they're very high risk for being hospitalized and dying from it.
Thank you. Okay. There's one question here about, as we're kind of wrapping things up, you spoke a little bit in the beginning about your experiences caring for folks with COVID. We have a participant who has asked, how serious can it be to get a mild case of COVID? There's been information that some folks have had lung damage after what's considered a mild case. What would you share to that effect?
So, people who are healthy and have a mild case often don't have long-term or chronic side effects. But, it's hard to know if you have risk factors that have been everywhere, like diabetes or high blood pressure, you're at more risk of having long-term side effects. We have this new coined term called Post-Acute COVID syndrome, where people have side effects and long-term sequelae from the disease. I think sometimes when these people are hospitalized, there have been cases where we're surprised at how sick this person has. They didn't really fit the specific criteria, but they got really sick. So, it's not an exact science. The majority we know who will get significantly ill from, but there are other cases where we're like, they didn't have any risk factors and they were really sick in the ICU.
Thank you. So we've heard some stories coming out that the vaccine is not as effective against the new variants, the different strains that are coming out of the COVID virus. Is it likely that the vaccines we are having here today, Moderna, Pfizer, and Johnson & Johnson to come, will they have the same issue? Do we know anything about their effectiveness against variants?
All right, so the variant backstory. So to understand what the variant is, it's really, so when you have an infectious disease like coronavirus, fastly spreading and has been out for a while, then the longer it's present and prevalent, the more likely it can mutate and replicate in what we call a variant. So we've had 3 variants that we know of. I'm sure there are more because we haven't been able to nip the coronavirus in the butt. So we've created these variants, unfortunately. And so the whole idea is kind of, we are in a race against time. So we have to, get coronavirus under control so that we can further reduce the risks of having more variants. These vaccines are effective against the coronavirus. In terms of the variants, it seems that they're not as effective against the variants. But again, these are new. We're still studying them. The thought is that it's still protective against severe disease. But the variants, there's 3 of them that we know of, and I think they are concerning for the healthcare professionals. And now we're kind of racing against time because we want to prevent further variants from happening.
Thank you. Before we wrap up here, I would like to just allow, if anyone is wanting to ask their question live vocally, please just raise your hand and then I will unmute you. I'll keep my eye out for hands coming up. Okay. I see Angel Benowitz. I'm going to unmute you, and then Adela Edwards, if you are still wanting to share a question, I will have you speak next, okay? Angel. You are good. You're unmuted.
Hello. Yes, I just asked in the Q&A section. I would like to know if mid-age people in Ithaca with no big medical conditions would receive the vaccine this year, because we are near spring now, in 6 weeks. It seems that we are the forgotten. While we are the group who need to work,
Sure.
pay taxes.
Yeah, I know it's super, super hard to be on the waiting end for this vaccine. And I completely empathize with you in that regard. It's one of those things where we're waiting on the supply to be available. And as we work through the phases and get more available vaccines locally, we will alert the public. The Tompkins County Health Department will send out information to let everyone know who can get vaccinated, how to get vaccinated, and when they can get vaccinated. But as of right now, it's really waiting on those vaccines to be here, to be available. So I appreciate your question. I think we are all feeling that, it's been a big hurry up and wait situation. We just ask for your continued patience on that, and to, please follow the Tompkins County Health Department for updated information as more vaccines become available. Thank you for your question.
Thank you.
All right. Adela, I'm going to call you up in case you still have a question you wanted to share live.
I sent it in writing. Can you read it, please? Thank you.
Sure. Okay. So I'm not sure if this is your question or not, but we do have one question left in our box. So let's see. The public is being told not to worry about potential future unknown vaccine side effects. Why might that be?
I think that side effects should be addressed. I think the nice thing about this vaccine rollout is now, hopefully, Shannon, you guys can post where you can enroll into these programs that are monitoring your side effects, and you can report them to the health department, or it's a program where you can say, my arm is sore or I have a headache. And so millions of people are reporting any side effects that they have live. So as we rolled out, there have been more than 40 million people that have already gotten this vaccine, and they can report any minor side effects, severe side effects, so that the FDA, the CDC can enact on that if there's anything significantly concerning. No one wants you to ignore your side effects or just dismiss them, but we want you to be aware that they are common and that they will likely happen. The severe side effects is rare, but to be aware of it, but it is very unlikely.
Adela, was that your question, or feel free to share our question?
No, I'm sorry, that was not my question.
Okay.
You don't have another question?
I do not. I don't see
I send it under chat. I breathe the vapor over boiling water, trying to kill any virus that has taken residence in my sinuses or throat. Does it make sense? And could you explain how does the virus takes residence? I don't know what you call it, but in our bodies, what's the mechanics of it?
Yeah, so it's considered, airborne in the air, the droplets. So when people sneeze or cough, they're spreading their droplets, secretions in the air. And the idea is that it spreads through the air and the environment. So when you're indoors, you're more likely to get it than you are outdoors. That is the same idea with having this HEPA filter in these COVID rooms, or people who we think have COVID, to help purify the air to limit exposure and spreading the disease. Humidifying your air, I don't necessarily think it's purifying it, so I'm not really sure. There's not really any evidence to humidify the air that's going to reduce the amount of particles from coronavirus. I think it's really the specialized HEPA filter that helps purify the air that has shown to be proven effective and helping another layer of protection.
Thank you, Dr. Rooth. I think that is all the questions we have for today. So we will wrap it up on time. That's great. I would really like to just thank every one of our attendees for joining us today. You've asked really great questions. I'm really grateful to be a part of a community that is really paying attention to this, is concerned, wants to learn more. The Tompkins County Health Department will be having additional vaccine Q&As throughout the rest of this month and into March and beyond, as interest exists for those to occur. So thank you all so much. I would really encourage everyone who has questions about the distribution of the vaccine, when it will be your turn, please sign up for those alerts through the Tompkins County Health Department. Those links to that are in the chat box. If you would prefer to get phone alerts or text alerts, you can sign up for the Swift 911. You might not get COVID only alerts through that. So if you really only want the vaccine information, sign up for the health department's email listserv as your best bet for that, and follow them on Facebook and Twitter as well. Thank you so much to Dr. Rooth for your expertise today, for sharing your personal stories, and for really helping to break down these concerns about the vaccine and what we should do as a community. Are there any final thoughts you'd like to share with our attendees today before we close up?
No, thank you, Shannon, for having me. I wanted to just express my perspective and to help people feel informed and educated and feel comfortable about getting vaccinated.
Okay. Thank you all so much. Thank you for your patience with my child interrupting us. And again, thank you all so much for joining us today, and stay tuned for more information.
Thanks, Shannon. Bye.